Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls right here in the studio to speak with Dr. Darrow at 866-870-5752. That's 866-870-5752. When you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, and it explains regenerative medicine to you if this is a new paradigm for you. Also, you can go to Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on videos. And what else do we have for you here? The office. If you've been listening for a while, you want to call the office and just make your appointment. People answer the phones 24/7 at 800-300-9300. That's 800-300-9300. And remember, our topic is orthopedic pain, muscle pain, joint pain, knee pain, stiff joints, dull aches. We had somebody with a cracking noise in his shoulder earlier, so a million different things can be going on, right, Dr. Darrow?
Yeah, let me get a question in here, Anita, if you don't mind.
Sure.
Let's see, we haven't talked about knees today, so here's one on knees that just came in. My issue is my knees have some arthritis, but I cannot do a squat at the gym. Good. You shouldn't be doing squats. People hate me when I tell them that. Too painful. I am 62, active gym, CrossFit type, 3 times a week. Only survey was a meniscus tear 14 years ago. Can you help me? Probably. So let me talk about squats. Squats are fine, lunges are fine, but don't do a lot of them. I get people that come in of this nature whose knees are absolutely destroyed by these type of exercises. So you got to be careful. The best way to do a squat is stand up against a wall and keep your feet in front of your knee and have your femur, that's your thigh bone, no more than about 45 degrees down. Okay, so you don't want to get a lot of weight on your back and squat down all the way. It's just too much pressure. But I have been able to help these people using platelets and stem cells. So that is the good news. The bad news is once damage is done, no matter what we do, it can still be a weak spot. And if you want to continue doing squats and your knees are already trashed, you're going to be seeing me very frequently. We're going to be best friends. And that's fine with me, but you have to consider what you're doing to yourself. Most of us athletes don't want to quit. It's very difficult to quit a sport or to quit a certain type of exercise. But we have to consider long-term what the issue is. The body is, in a sense, a mechanical device. It is biological, and we can regrow tissue. But you can also wear out the tendons and the ligaments and the muscles where they attach, the enthesis, where they attach to bone, and the joints, like this person with their knees. So can I help? Yes, I can help, but you may have to cut down some of the intense activity. When the person says they're a CrossFit type person, that means that they're willing to go the long mile, the hard way, to build up muscle and stay in shape. And there are better ways. We're finding out that less is more with exercise these days. And I've got to really admit it. I'm as bad as everybody else. I keep going when things hurt. I fight with myself not to exercise because I want to do it all day, all night long. I just love it so much. I have been able to use stem cells and platelets on my knees. Thank goodness they healed me up, but I wasn't doing heavy squats. I have one patient who's a 28-year-old man who came in with, I'm going to call them tree trunk, giant, muscular legs. And as soon as he walked in, I should say he limped in with a swollen knee. I said, "You do heavy squats, man." And he goes, "Yeah, I do. I love feeling like this." And I said, "Well, you can keep doing them if you want to have to keep visiting me and getting treatments. But I don't think you're going to want to do that. You're going to have to back off and go to lighter weights and less active squatting. So got to be careful. The body is something that can wear out. Regenerative medicine can regrow the tissue, but why have to do that if you can help yourself? Always do the things most conservative. And in a case of someone who is an overachiever in the gym, the thing that you can do is back off. And a lot of people come in and the first thing they say is, "I'm not going to stop what I'm doing. Can you help me?" I go, "Yeah. And you're going to be visiting me quite a bit." And they go, "I don't mind. I'll do it." We have someone who's become a very good friend of mine, a patient named George Chung. George, if you're listening, which I know you do, God bless you. He is one of the top skiers and bikers that I know. And he doesn't quit. He just keeps going. But he visits me every few months. When he first came in with very arthritic knees, he was in miserable pain. We got his pain better, but he kept coming back. I said, "You don't need to come back. Your pain's gone." And he said, "Well, I'm going to be coming back because I know that what I do causes arthritis, and I'm not going to quit." So we see him from time to time, and we give him what I'm going to call prophylactic injections at this point, because he's still not having pain, but he's still working out like a monster. And that's what he wants to do, and he's allowed to. So George and I have become very, very good friends. So anything from you, Nita, or should I go with another question?
I love that story because it says like we're looking for quality of life here. That's why we want people out of pain, right? But quality of life might be that you continue doing your sport even though you risk having pain or whatever. So a lot of choices here.
And we do see people, that come in with meniscal tears, ACL ruptures, MCL, LCL issues. So, yeah, we can get them better. But then the question is, how often do they want to come back and visit? How much do they need to keep doing their sport or their activity? And a lot of people do things that are like a sport. It could be gardening. And people say, "I don't do any sports, but I garden." And they're such maniacs in their garden that they can cause arthritis. I know, it sounds crazy. But we all have things we love.
Yeah. Oh, yeah.
A lot of gardeners coming in with knee and back and neck pain, wrist pain, finger pain, you name it. We work all over the body, and we can grow back tissue anywhere on the body where there's pain.
And our number, if you are in pain and you want to talk to Dr. Darrow right here in the studio, give us a call, 866-870-5752. That's 866-870-5752. Check out the website at www.lastemcells.com. That's www.lastemcells.com. You can see Dr. Darrow performing the treatments on videos, and you can email him off of every page on the site. There you go.
I guess let me take another question.
Oh, the free book. You get a free book today, Stem Cell and Platelet Therapy, Dr. Darrow's latest. Now you can take your question. Thank you.
Yeah. You get a free book if you call us up.
Yeah.
866-870-5752. We love talking to you. This question is about, it's titled Back Pain. It's very short and simple. The person says, I've been having chronic back pain for about 5 years. I'm sorry to hear that. I'm hoping you could tell me more about stem cell therapy. Yes, of course. So typically people who come in with back pain have had an MRI, and it has shown things like facet arthropathy. That means arthritis in the facet joints. Herniated discs. I've got herniated discs in my neck and my back. A lot of people have them, but it's not the cause of any pain. And they don't get that because once they see a doctor who does surgery, the doctor typically says you've got pain, yes, you've got a herniated disc or you've got degenerative discs, and we need to do an operation to replace the disc and cut out that bad disc. And that's not generally the case. It's usually the ligaments that are sprained. I had an old friend come into the office yesterday as an example, and he had a flare of low back pain, which he gets once in a while. He's very, very active. He does kettlebell exercises. I don't know if anyone has ever seen that.
No.
You swing a kettlebell up in the air, and then you bend down and you bend up. And I touched his back, and he said, I've got terrible discs in my back, and I can feel my discs hurting. And I started laughing. I said, Michael, there's nothing to do with your discs. He says, and you would never know what the cause was anyway. So it was the ligaments. And I injected him in a few seconds. He said, I think I'm feeling better. So be careful. Don't jump to a surgery because you think that an MRI or a surgeon tells you that MRI shows something. My friend Michael has a ligament sprain. Those are easy to fix. They parade around and they hide as herniated discs, arthritis, and other things when it really isn't even the issue. So, should we go to Salvador with his fingers?
Let's.
Salvador, Dr. Marc Darrow, how are you today?
I'm fine, thank you. We got a little rain this morning. Looking pretty nice now with the sun coming out.
Good. So, what's up with your fingers? How long have they hurt you for?
Well, I'm 33 years old, and I'm like, I was almost like I was kind of like negating the pain. And I will say, like, for the last maybe 1 or 2 years, I just kind of sort of like, okay, I'll stop typing now, and hoping it'll go away. But so in my job, I'm required to type a lot. So I will say it's been for 2 years, and it just is this pain, the joint pain, and then it's very uncomfortable. But I guess I just always negated it, and it's not until I heard your show that I'm interested in just making a call to see what I learned.
Good. Have you seen a doctor about your fingers yet?
I have not.
Okay. You may want to get an X-ray, which we can order for you if you like, and see if you have any arthritis that's brewing from all your activity. It may not be. It may just be the overuse because you type for a living. And when a lot of people come in who have something like that, they have wrist pain, elbow pain, forearm pain, finger pain from overuse, I say you have to slow down what you're doing. They say, I can't. I have to continue for my job. But that typically is not the truth. The workers' comp laws in California, at least, allow people to be put on a different job if they're having pain from what they're doing. So you should talk to your boss and see if you can do something else for the company. Okay?
Yeah.
That's the easiest way to see if your pain can go away. If you can stop doing it for a while, maybe the pain will just disappear and you're going to be a happy man. If you can't stop, or you do stop and the pain continues, come see me. Let's see if we can use some PRP or stem cells and thicken up the tissue around the joint and make you feel better.
Got it. So step one, I'll go see my doctor and order an X-ray, and then step two, depending on that result, I may either talk to my boss or come to you all to see how you can support me.
Sounds great, Salvador. God bless you, man. Good luck.
Thank you, my man. Appreciate you.
Thank you, Salvador. Appreciate your call. Our number here in the
33 years old, and it's still happening. It's starting
I know.
to happen. It's too bad. Okay, you're going to say the number to call us is 866-870-5752. Please call us. Let's talk to you. Let's figure out what's bothering you or your family or your friends and see if we can help. See if we can use regenerative medicine of platelets and or stem cells and heal the area.
Great idea. 866-870-5752. We're here Saturdays at 10, again at 1 p.m. And when you call the program today on that number, right here in the studio, 866-870-5752, you get Dr. Darrow's latest book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate.
Shall I take another call here?
Sure. Another question? Absolutely.
I love tripping you up, Nita. It's
I
so
know.
much fun.
I know. I love it too, actually. We have to stay in the fun zone. If we want people to be pain-free.
That's right. We got to laugh.
We got to laugh. And actually, while we wait for these two calls to queue up, if you want to take a quick question, go for it.
Yeah. This one is on plantar fasciitis. And you can kick me off if I get boring or if the other people are ready.
Okay, stop right now. Just kidding.
So here's a question on plantar fasciitis. And the person says, if one PRP injection, and for those of you that don't know what that is platelet-rich plasma. It's using platelets from your blood. It's a simple procedure. We draw the blood, we spin it in a centrifuge, we throw away the red cells that hurt, and we use the platelets and we inject them. So if one PRP injection doesn't help for plantar fasciitis, when can I have the second one? You can have it the same day if you wanted to. Usually we wait a couple of weeks, and there's a flare of inflammation after we do the injection. If someone is in a rush to heal, or they're from out of town, let's say someone flies in from Europe, we will probably inject the bottom surface of the foot where that spring ligament attaches to the calcaneus. We'll probably do it like 3 times in 1 week. The most I've ever done on myself was for a knee injury. I injected myself with stem cells 4 times in 1 week. I had 35 cc's of fluid in my knee, and that knee is doing pretty darn good today. So I'm doing real good. I can run, I can play golf, and I wanted it fixed quick, so I did 4 treatments in 1 week. Most people, we have them wait for a couple weeks and see what's going on, but it's up to the patient. Let's go to Stephen in Thousand Oaks. Your wife has back and shoulder issues. Tell me about it, Stephen.
Hello?
Yeah, Stephen, this is Dr. Marc Darrow. What's going on with your wife?
Hi, Dr. Mark. How are you?
Living it up,
Still
man.
at work, and this has been going on for over a year. The doctors are looking at surgery right now, but we'd rather not go that way if we could. But she fell and hurt her back, and then that started numbness up her arm, and now her shoulder is bad. And she just got a cortisone shot a couple days ago, and it's better now. But cortisone's just temporary. So I was just listening to you, and I'd love to have that book and read it, and I know she would read it also.
Well, we'll send you a couple of them then. Don't worry about it. So a couple things right off the bat that you've said. You said that cortisone is temporary, and I want to let you know that cortisone is not temporary because it causes permanent damage.
Oh. Didn't know
What
that.
it does is it thins out the tissue. So we don't want to use that. Yes, it helps. Yes, it helps get rid of some pain in most cases temporarily, but it's not worth doing that. What you want to do is fix it. How do you fix it? You regenerate the tissue. You stimulate new tissue to grow using platelets or stem cells from the person's body. That's easy. Very simple. You walk in, you get an injection, and you walk out. So I think there's good hope with her shoulder, especially since the cortisone made it feel better. That lets me know that the solution of the steroid got to the pain generator. We can do the same thing with your wife's platelets or stem cells and actually heal it up. I would never get surgery for that.
Yeah, it's not something we look forward to.
The back pain, I'd have to touch the area and see if that's something we can fix.
Okay.
If you decide that you want to bring her into the office, you can call there right now. It's 800-300-9300. My staff is on the phones all the time. If they're busy and they can't pick up, you can just leave your name and number. They'll call you right back.
And what's your website?
The website is www.lastemcells.com, www.lastemcells.com. Every page has a spot to email me, and that's where I'm getting a lot of these questions from, is people that send those questions to me. And you'll see pictures, or I should say you will see pictures, but you'll see videos of me doing these injections, and you can see if it's something that you think your wife may like, or you can show her that also. It's got a lot of research on it.
Show her.
Yeah, and a lot of information. You can give it to your doctor and see if he approves. Most doctors don't approve because they don't think that this stuff's going to work. We get questions all the time from people saying, my doctor said it's not going to work. And, well, that doctor doesn't do it, so how do they know?
Exactly. I agree.
If the doctor did it, he wouldn't be doing surgery anymore.
There you go. Thank you for your call.
Awesome. I appreciate that very much, Dr. Mark. Thank you so much.
God bless you, Stephen. God bless your wife.
Thank you, Stephen.
Thank you. You have a great day.
You as well.
You too. Live it up, man.
Okay, let's go to Leon in Fullerton.
Hey, Leon, Dr. Marc Darrow, and your knee is going out. Tell me about it.
Hey, glad to talk to you there, doctor. My knee, about 3 or 4 weeks ago, kind of took I don't know what's going on. It, whenever I try to bend it, like I'm stooping over to pick something up or trying to get down on the floor, it just about kills me. And it's like, if I'm standing and I bend the calf part of my leg up where it's horizontal, it just hurts like heck. It's not swelled up or anything. And
it may not be swollen that you can tell, but it may be swollen on the inside. You may have what's called an E.
Absolutely. Yeah.
You may have.
I went to my family doctor, and they give me something that's in the ibuprofen family. It's a prescription and some glucosamine or whatever that stuff is, and it helps a little bit, but it still hurts. So I thought I would give you a call.
Okay.
Okay.
Sorry, the show is over. Go to the website, www.lastemcells.com. Email me from there, Leon, and we'll finish up the conversation personally. God bless you.
Thanks for your call. Thank you, Dr. Darrow, and thank you, Alex and Suzette, and everyone behind the scenes. And listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.